Hello everyone, my name is Ravi and I work at the Royal Pharmaceutical Society. I'm back today with another one of my daily updates for pharmacy in relation to the COVID-19 pandemic and some of the work that the Royal Pharmaceutical Society are doing on behalf of the profession. One of my first updates, some of you may have seen Matt Hancock's address to the nation yesterday evening, where he was really speaking positively about pharmacists and their crucial work on the front line from a recognition perspective. As I may have mentioned earlier this week, the RPS sent a letter to the Secretary of State to be more aware of and recognise the fantastic work that pharmacists are doing on the front line and their support teams. Further to this, there were several other announcements that he made. In particular was the opening of a hospital in London in the Excel Centre that will be known as the Nightingale Hospital, which is planning to be open this Friday. He also announced the NHS Volunteers Programme in collaboration with the Royal Voluntary Service. We're asking for further information in relation to the hospital developments and what that means for some pharmacy teams. We would assume that pharmacy would be involved in it, but then also whether the NHS volunteering scheme is available for our professionals working in Wales and Scotland. Secondly, the RPS has written to the British Retail Consortium to ask and to make sure that pharmacists and their support team are included as part of the priority list for NHS staff that are able to access supermarkets every single day. We've also published a letter that pharmacists and their support teams can use if they do not have NHS ID to be able to take to those supermarkets to ensure that they gain access. We've also had some further discussions across Scotland, England and Wales in relation to our policy asks with our respected organisations, and just to remind people what those key policy asks are. The first thing we're asking for and fighting for is ensuring that frontline pharmacists and their support teams are protected against COVID-19, ensuring they have adequate supplies and quality of personal protection equipment that's available across hospital and community pharmacy colleagues, but also across the entirety of frontline NHS staff. We want to make sure that pharmacy teams have access to COVID-19 testing as an absolute priority. We want to ensure that pharmacists have a supported and funded mental health and wellbeing programme in order to ensure that they're well supported during this time. We understand pressures are high, lots of demand placed on you as well, and exhaustion and burnout can potentially happen. So we want that to be in place as well. We're also talking about security for pharmacy teams across the health service as well. We have been hearing that there is some members of the public that are being really aggressive and violent towards pharmacy teams, and that needs to be stamped out as well. And I'll give you an update very shortly on some of the work we're doing on that. Secondly, we want greater recognition from government in national communication and support, but also from the NHS around the valuable work pharmacists are doing. Additional funding and resourcing for the pharmacy network to help continue supporting the public, a fully funded NHS delivery service to ensure the delivery of medicines for pharmacy teams, allowing pharmacists to enable them to focus on supporting patient care, flexibility in our respected community pharmacy and other pharmacy related contracts, but also an immediate cash injection to pharmacy to support their resilience and sustainability, in particular to help prevent closures, improve cash flow, and to help with some of the rising costs and credit bears that community pharmacy will be experiencing right now. Fourthly, ensuring that medicine supply chain is maintained through this process and working with our Royal College of GPs and other organisations to ensure that prescribing patterns are maintained and that not long durations of prescribing occurs, and a promotion of electronic repeat dispensing. 5, communication with the public around the great work pharmacy teams are, but most importantly, when they should access pharmacy teams. If they're experiencing symptoms of COVID-19, it's best not to go to pharmacies, do not enter those premises, and be able to call them up, maybe ask a friend, family member to go and help collect your medicines if appropriate and where needed. 6, NHS funded backed indemnity insurance scheme as well. We've had some information in relation to that around community pharmacy, hospital pharmacy and general practice pharmacy. Anyone's activities relating to the COVID-19 pandemic, particularly from a treatment and diagnosis, will be protected under state-backed. But what we're also arguing for whether that indemnity scheme will be covering returning to workers and volunteers working in pharmacy, but also the ability to have fast-track and funded DBS checks. And lastly, this easing the workload related to medicine shortage. We would like greater autonomy for pharmacists and their support teams to be able to manage the supply chain a lot better rather than to go back to the initial prescriber for a common amount of advice to try and change prescriptions, such as volume of prescriptions, formulations. It will be a lot more quicker if community pharmacy teams in particular would be able to do that on a much more easier basis. Lastly, around some of this stuff, we've been also sent a letter to the National Chief Policy Council today following the concerns raised from the profession and our members around inappropriate, aggressive and sometimes violent behaviour they've experienced from some members of the public across community and hospital pharmacy settings as well. As I may have mentioned yesterday, this is completely unacceptable and should not be tolerated. We've asked the police for greater support from increasing their patrols around pharmacy premises, but also hospital services as well, to ensure our NHS frontline staff are safe, and for police to have a zero tolerance approach if they were to see or witness any of this behaviour. 5, better recognition. We've been doing a lot of stuff in the media recently from the Royal Pharmaceutical Society. Make sure that you get the recognition that you deserve. We've been on the news, we've been on TV, radio, newspapers, raising the awareness around the increased workload, but also the fantastic job you and your teams are doing on a day-to-day basis, and the importance of supporting the pharmacy network during this really challenging and difficult times. We are working as hard as we can to help you and to help what you are doing as well, trying to take off the stress where possible. And if you have any ideas or suggestions, please message us through our RPS support line. We're all ears and we're really willing to try and help and listen to you. Just some updates in terms of RPS resources that I thought could be really helpful for you. We've got some more information on the RPS website around the NHS volunteer service that could be really useful for you to access some top tips and guidances, what to look out for when you're expressing your interest. We have a brand new RPS COVID-19 educational webpage with lots of new material to support your continual professional development. In particular, this is really useful for returning workers or retired workers going back into the front line, or anyone who's thinking of becoming a volunteer as well. Thirdly, we've also been working with the UK CPA Critical Care Group around developing a new guidance document that is now available on the RPS and UK CPA websites. And we're also doing a free webinar for everyone tomorrow with the UK CPA, touching on sedation, acute kidney injury and medicines reconciliation in critical care as well. So do look on the website, look on our events page. You'll be able to register it for free and just fill out some simple details as well. Once again, thank you for your absolutely fantastic and heroic work on the front line. Your resilience is absolutely incredible. We are really grateful, the NHS and grateful. I can assure you now that the public are also really grateful as well. Thank you, and I hope to catch up with you all tomorrow.